Hello everyone, my name is Dr. Dimma. Welcome to our YouTube channel, and today I want to discuss the risks and complications of plastic surgery. So if you're new here, please do well to subscribe, like our content, share it, and of course follow all our social media pages. For all our existing subscribers, we love you and thank you. Now, to the matter of today, plastic surgery is a branch of surgery where we work to physically improve or enhance different aspects of the body. Many times our clients have the idea that surgical procedures are simple, like a spa day, especially when we say mommy makeover. They assume that these procedures do not have serious risks or possible complications. And this video is to clear that misunderstanding. Even though it is surgery done to make you more beautiful, there is still risk, there is still a possibility of complications, and there is still downtime, time that you are doing nothing else except laying down and recovering. In this video, I'll break down all these risks and complications so that you understand them and you're able to make an informed decision when you are planning to have plastic surgery with us. Alright, so I like to see the entire surgery process like a party. It helps me to better explain it. And the surgery is the party. The risks are the organizers. So once you say, oh, I'm going to have surgery, these risks are there, present, they are waiting, they are part of the organizers of the party. The complications are those people that attended the party, but we didn't plan for them, we didn't invite them, we weren't expecting them. So that's how I explain risks and complications to all our clients who come through for their plastic surgery procedure. So the risks, I like to explain 6 major risks of surgery. Now, all over the world, these risks are the same. They are the same because people tend to look down on our country and say, oh, because you're doing it here, maybe do it in this place. The risks are the same all over the world. There is the risk of anesthesia, the risk of blood transfusion reaction, the risk of infection, the risk of traumatic damage to internal organs, the risk of fat embolism for those that will be grafting fat, and the risk of blood clots. All over the world, these risks are the same. What makes the difference? These 3 things. First, regulation. How much regulation is in place in that country to keep the healthcare providers and the patients safe? How much regulation is overseeing the work that the surgery clinics are doing? Secondly, resources. So countries that are well developed have all the resources. Ours is developing, and it means we still have to import a lot of the resources we use for our patients. But this determines sometimes the outcome for the patient. And then finally, results. How much results are the surgeons willing to push for? In places like the US, they won't exceed their 5-liter limit. They'll have the amount of fat they will graft. They do just what they can do for you. Over here, we understand what an African woman wants to look like, and we are willing to push a little more to give you those results. So these are the 3 things that change the outcome or results of surgical procedures, but I can assure you that these risks are the same all over the world. So now let's talk about it one after the other. For the risk of anesthesia. Anesthesia is the process of keeping you pain-free during your surgical procedure. You also have some amnesia so that you do not remember some of the things that happen, especially if you are under general anesthesia. You can also be awake, meaning that anesthesia is regional, maybe spinal, epidural, or conscious sedation if much is not being done for you, if it's a quick procedure. Many surgeries go on smoothly without any hiccups or problems with anesthesia, but still there is significant risk for especially general anesthesia, and these risks include severe allergic reactions to any of the anesthesia agents. There could be paralysis of any limb, there could be irregular heart rate, there could be problems breathing, and sometimes, even though we do not expect that or it doesn't happen, anesthesia problems can even result in death. So there is significant risk with anesthesia. But what do we put in place to see our patients safe truly? First, we work with fully qualified anesthesiologists who are also knowledgeable on critical care. We also have all the equipment that we need to use if we have to take care of any of these anesthesia complications or any of these anesthesia adverse events. So the second risk of surgery that I'd like to discuss is the risk of blood transfusion reaction. We all know that during the procedure, fat cells will be sucked out. Sometimes large chunks of belly tissue may be trimmed off during a tummy tuck, and that means that there is the possibility of loss of blood. For all our patients, we usually have at least 2 pints of blood on standby to anticipate that loss occurring. But the problem there now is that some people may now react to those blood, to the cells in those blood bags. Why does this happen? Broadly, it can happen if there's a mismatch. It can happen if there are some elements or proteins in either the recipient or donor's blood that doesn't go together. So for the risk of blood transfusion reaction, this is our approach. We do not even intend to transfuse. We do not plan to transfuse. All our patients, so long as your hemoglobin is more than 12.6, our plan is not to transfuse you. But if it gets to the point where your blood levels is low after surgery, that's less than 8 or almost 7 for the hemoglobin, and you have symptoms, you're finding it difficult to move around, you feel dizzy, your heart is beating fast, so it means your blood level is low and you have symptoms, then we can consider giving you blood that has been grouped, typed, cross-matched for you using your own blood, and double screened for any of the diseases that can be transmitted via a blood transfusion reaction. And our protocol here during this process is that a doctor and nurse will compulsorily be by your bedside until that transfusion process is done. This is so as to monitor your vital signs, and peradventure you feel some type of way during the blood transfusion, which is a fever, a spike in your blood pressure or your heart rate, or a rash, difficulty breathing, anything that indicates that this blood is not going well, they will discontinue it immediately, treat you, and initiate the protocol for a transfusion reaction. Moving on to the next risk, that is the risk of infection. Like I said, these risks are the same all over the world. The risk of infection is not higher because the procedure is happening here in the tropics or in Nigeria. The risk of infection is high. So long as something has breached your skin barrier, your immune system is exposed to the environment, and there is always that risk of picking up microorganisms from the environment during your surgery. So what are the special things that we put in place? First is a strict sterilization protocol. We have experts that come here to do our sterilization for us, to do our theater washdowns, to make sure that all the instruments being used for your procedure has been thoroughly cleaned, sterilized, with indicators that read that those instruments have been passed through the adequate amount of heat for the adequate amount of time. These things are stapled on the case files, and for us they are evidence that everything used for you has been sterilized. In terms of metallic instruments, the others are considered consumables and disposables that are single use. We do not reuse them. Once your procedure is done, they are completely discarded, and for every new case we open new consumables for the patient. So that is our first way of ensuring that organisms or bacteria in the environment do not get into your system. Strict sterilization process. Second is the use of branded antibiotics. There are many good antibiotics in the market, but we stick to the branded ones so that peradventure you are not responding well, we know when to change the protocol and go to something stronger or higher for you. And finally, for the risk of infection, the nursing care. The care here, the nurses are already experienced and skilled to care for you without contaminating your incisions or introducing infection into your wounds. So that is what sets us apart. All our nurses are expertly trained at every level. The estheticians in the spa, the therapists, everybody knows how to take good care of you and ensure that your incisions are not infected or your surgery wounds do not get infected by any bacteria. So that is our protocol to reduce or completely eliminate the risk of infections. If you've watched this video up until this time and you're interested in finding out more about your own surgery process, we always attach the link to our consultation process in the description below. If you also just want to have a chat with us, you can still go through our email to ask specific questions and we'll be happy to respond to you. Moving on to the next risk of surgery, that is the risk of traumatic damage to internal organs. If you have watched the process of liposuction, you would see that the provider is holding an instrument that is long with a blunt tip and using it to go back and forth over areas of the body so that the fat lobules will pass through tiny holes in that instrument and be extracted. That process is very energy intense. It takes a lot of energy because in some people, the fat cells are tightly adherent to the skin. Some people that work out, that eat heavy carbs diet, and just genetics, or those who take a lot of collagen. People like to take substances, but this is the downside. So the skin is very tough and firm. So even to extract the fat, it's not that easy. So the process is energy intense. With the right amount of carelessness, anybody who is not experienced or skilled can use that blunt tipped instrument to enter an organ space or choke it hard enough that the muscle along the belly is breached and the person finds themselves either in the chest cavity or in the stomach cavity. It is very rare, but like I said, with the right amount of carelessness, it could happen. Again, not even carelessness, in those that are very big, where there's a lot of fat layer or tissue, that can also happen. So it is a possible risk. It is documented. What do we do to avoid this risk? The first thing is that when we need our patients to lose weight, we tell them to lose weight so that we are dealing with a less thicker layer of fat so as to avoid the cannula mistakenly going into any body cavity. Another condition that predisposes people to this risk is if there is a hernia. A hernia is an area of weakness in the abdominal wall. That area of weakness means that all the components in your abdominal cavity, like the intestines or organs, that they can be reached through that area of weakness. So that is why when people have a hernia and they're interested in liposuction, we postpone the surgery and schedule them for a herniorrhaphy or hernia repair first. After they heal, we can then proceed with the procedure or the surgery. So what to do to reduce this risk is, first, ensure that your providers or your surgery clinic is run by fully experienced, certified, licensed medical professionals, a surgical team that knows what they're doing. They are experienced, they have a good success rate. Ensure that your team, it's not just you're going to surgery and they're not telling you, oh, these are the people that will do your procedure, these are the people working on you. Ensure that this team is fully qualified, certified, and experienced for this surgery. And then if you have a hernia, please repair it before coming for liposuction. The fifth and sixth risks of surgery that I like to discuss, you can call them the same thing, foreign bodies in the bloodstream, because the one foreign body is fat, the other is a blood clot. So anything that is not fluid or liquid blood in the bloodstream is a foreign body, and once that thing is moving within the veins, it is called an embolus. If it is now fat, then that is a fat embolus. If it is clot, that is a venous thromboembolus. Sorry for all the big words, but we will be explaining some of these things to you. Now, the risk of fat embolism occurs in those who are doing a BBL. This happens when the provider mistakenly injects fat cells into a blood vessel. Now, you know that all blood vessels, especially the veins, are taking blood back to the heart. The arteries take blood away, the veins take blood back to the heart. So if fat has been injected into the blood vessels, the veins will carry it back to the heart. They have to pump it to every other part of the body, including the lungs. And when these fat cells go there, they begin to cause problems because they will block tiny blood vessels that is supplying that organ. If it goes to the lung, it's a pulmonary embolism. If it goes to the kidneys, it will cause kidney problems and could cause kidney failure. And that is why the most feared risk of undergoing liposuction and fat grafting or BBL is what is called fat embolism. Now, what do we do to ameliorate this risk? The first is that in those who are very slim and have little or no fat pad in the buttocks, we can use the ultrasound technique to guide. This will tell us the amount of fat they have so that fat can be safely placed. The second thing is a very strong clinical acumen and experience, somebody who is used to performing procedures for women of all shapes, sizes, would know the safe zones of placing fat in the buttocks. The third way, which if any patient desires, we are always happy to indulge them, is to decide not to do fat grafting or a BBL. That is up to you. But the ultrasound techniques makes fat grafting very safe for the patient, and also with a good clinical acumen and experience, fat can be placed in areas that are safe in the buttocks, reducing drastically the risk of undergoing or experiencing fat embolism. The sixth risk, like I said, is still a foreign body in the bloodstream, which is a clot. How does this happen? Remember that you'll be lying in one position for 3 to 6 hours, sometimes 8 hours if a tummy tuck procedure is being done. Now, a clot forms when there is slowing down of blood in the deep veins in the legs. When the blood slows down, a clot can form. Let me use the word congealing. A clot can form, and when that happens, and for some reason the blood flow moves quick again, that clot can be carried, moved all the way from the lower legs through the abdominal aorta, that's the big pipe that supplies blood, all the way to the heart. As usual, anything that comes to the heart will pump it again to the lungs. Why? Because the lungs cleans up the blood for the system. And when that happens, you have what we call deep venous thromboembolism. And just like fat embolism, this can cause a lot of breathing problems, problems with the brain, problems with the kidney. It's an issue. Many times the patients end up in ICU for care and support until they recover. So what do we put in place to reduce this risk of blood clots? We use pneumatic devices that ensure that the blood in the lower limbs keep moving gently towards the heart, keeping that flow going so that it doesn't slow down and clot. Then after surgery, we give injectables that can keep your blood liquid. So they are called anticoagulants. And for the next 7 days, after you use the injectables, we still switch you to tablets that can keep the blood liquid and flowing. Before surgery, your clotting profile is assessed so that if you are prone to having blood clots, we are aware. If it will be unsafe for you to have surgery, we can then postpone your procedure and refer you to an expert for review. So this is a very lengthy video where we've discussed only risks yet. The second part of the video is where we break down the complications of surgery.